Welcome back. It is Bernadette and I today. Michael is off traveling the world, and we wish him lots of good times. I think he's in New Zealand, I believe. But it's just going to be us today. But we do have a topic that I think you guys are really going to like. It's one that we get a lot of questions about and has come up as something popular so far on our shorts on YouTube. So we're going to get to that in a second. But before we do that, I will go ahead and let Bernadette introduce herself, and then I'll do the same.
I am Bernadette Thompson, and I am an intuitive ancestral healer. And I came to do this work through my own background, which was in psychology and trauma, and my own personal experience where I went through a deeply personal loss, and it was the healing of understanding what my ancestors had gone through that brought me to understanding how important this work is. So that is how I made it here, and I'm happy to be here.
Thank you, Bernadette. And my name is Ruschelle, and I also came to ancestral healing work through my career path as well, and as well as my personal path. So I had a severe health event. I had disabling neurological Lyme disease, and it really unlocked all of these stories that my body was holding of my ancestors. And my ancestors also came to me and helped me recover from that. And it's been a wild and crazy journey with them ever since. So welcome. And I would encourage you to find a comfortable place to be, grab a journal and something warm to drink, because we're going to be diving into the roots of who you are. And that is what we do here every Tuesday on generally our live stream, but we're having some trouble with it this morning. So we're just recording it anyway, and we'll have that up to you shortly. So today, since Michael isn't here, we're going to structure things a little bit differently. Bernadette and I are going to jump right into the topic. And today's topic is From ACEs to Ancestry, Understanding Trauma Across Time. So a lot of times when people start to look through their genealogy or start to become curious about their family stories, they start to possibly notice that there are some skeletons in the closet, some things that maybe are difficult stories to recall. And sometimes that triggers us and reminds us of some of the difficult things that we've gone through ourselves in our own lifetime. So today's show is all about sorting out the difference between current trauma, which I'm going to be talking about it through the lens of ACEs, and I'll explain what that is in a moment. And then the difference between ancestral trauma, so that intergenerational inherited trauma that we have. And Bernadette is going to be talking quite a bit about that today. And then we're both going to be talking about the overlap of the two. So how do our own lived experiences interact with these historical experiences that our family has had and the stories that our body carries as well. So before I jump into kind of starting an explanation of ACEs, Bernadette, did you have anything that you wanted to add to that?
No, I think that's a great way of opening it up, because there is so much to learn on both sides and that connection. And I think that it will give our listeners a really strong understanding of all of the feelings, like how they can kind of understand what's going on in their own emotional trauma in their bodies.
Okay, so ACEs. So what are ACEs? Some of you may have heard that term before, but for those of you who have not, I'm going to break that down very quickly. So ACEs was a study that started in 1995 by the CDC. And ACEs stands for Adverse Childhood Experiences Study. And this study lasted 3 years, but then the data, they've kept doing research around this study. So Dr. Folletti, he was running an obesity clinic, and he noticed that patients who lost weight often dropped out. Through interviews, he revealed that there were these stories of childhood abuse linked to their obesity. So weight was functioning as a protection, he found, rather than a pathology. And that kicked off a study of over 17,000 adults. It's a survey. So it's a survey that you can still take. Many of you have probably taken it. They give it to you usually if you go to like your regular physician, they will do the ACEs scale. And what they have found in those questions, and I'm going to briefly kind of go over what those are, is that the higher your ACEs score, so the more of these things that you say you have experienced it in your childhood, the more likely you are to experience health issues, metabolic issues, cardiac issues. And now they're seeing that it also includes poverty. The more likely you are to have financial challenges at work. So it extends beyond the physical with the data. So the categories that the ACEs score looks at is abuse, so physical abuse, emotional abuse, and sexual abuse, neglect, both physical and emotional, household challenges when you were a child, so domestic violence, if there was substance abuse in the home, if either of your parents or siblings had a mental illness, if there was divorce or incarceration. And then there are questions around these issues. And then the more of these you score, the higher your ACEs score, and the more likely you are to have challenges. So that's a little bit of a background of ACEs. And that childhood trauma lives in your own body throughout your lifetime unless it is processed and addressed through therapy. So we can unconsciously have issues. We can have anxiety, depression, and all of the health issues that I just described. So I'm going to pause there. And Bernadette, if you would share with us, so now that we understand our individual trauma and the childhood trauma that we can have in this lifetime, can you give us an explanation of what inherited trauma is?
So inherited trauma is also related to all the things that Ruschelle just talked about that we may go through, that our ancestors may have gone through some of these personal things in their lifetime themselves, so that the abuse and things like that are part of what ancestral trauma can be, because our ancestors have experienced that trauma and it can be passed down to us. And the other types of trauma that it's different, is the difference between the two is where it originates. It's not about how it feels in our body, but it's where this trauma came from. So when the weight that you're carrying doesn't quite match what your biology or what you're feeling, there may be an underlying ancestral trauma that has happened. So research tells us that epigenetics, which is the study of how our genes react to trauma, other things as well, but certainly what happens when ancestors have trauma and how it gets passed down. And that was discovered when they started looking at the Holocaust victims and those who have been who are descendants of them, and they notice similarities in the trauma responses. So the other types of trauma, besides the personal trauma that we go through, that we can go through, there's also the type of trauma that affects a community. So these are the things that we may know about our ancestors, that a famine or dislocation, they had to move for some reason, or there was political persecution, all different types of things that would affect a whole community can also react as personal trauma for our ancestors, and those things can also be passed down to us. So I think that's just I know we're going to go into this more deeply, so that's just kind of a top overline.
Okay. So I want to kind of repeat back what I heard you say, Bernadette. The inherited trauma can be biological trauma. So, for example, if my grandmother was in the Holocaust, it could have a biological effect on my body. For
Correct.
example, I could have metabolic changes like diabetes or a predisposition to heart disease because of the stress that my grandmother went through. The other one that I heard you say is psychological. So if there were emotional stresses, I could inherit those emotional stresses that my mother or grandmother or grandfather had as well. Depression, anxiety, because of their lived circumstances. So I could have depression that was not related to my lifetime.
Correct.
I could just have it and not know why I have it, because maybe everything in my life is pretty good. But yet it's there anyway. I also heard you say systemic. So displacement, oppression, poverty. So those types of events in my family history can cause me to have certain behaviors. For example, maybe I have a poverty mindset and have difficulty maintaining my finances because of because of the poverty stress that my ancestors went through. One thing that where the overlap happens, I think, is one that we haven't mentioned yet, which is parenting styles, parenting and coping strategies. And that's where this idea of ACEs really has an overlap. So I want to go back just a minute and talk about the impact of ACEs. So those stressors that we had when we were kids, if our home was stressful, if our parents were abusive or had issues with drug addiction, any of those sorts of things, they were time bound. So they were in my childhood in that time frame. Whereas intergenerational trauma crosses time. It moves from generation to generation, and the actual event doesn't have to be happening in my lifetime. And Bernadette, just chime in whenever whenever you want. But I'm going to go through the differences here. ACEs are event based, meaning I was physically abused as a child. That was an event that happened to me. Intergenerational trauma is pattern based, meaning it repeats, the patterns repeat over and over again. We are 6 generations of alcoholism. That's both in the moment, and it's also pattern based, right?
It is kind of like and I heard this once, that your DNA is like a piano. All the keys are there, but the experiences that happen to your ancestors influence which keys get pressed. And so some of those keys were pressed before you were born. So in other words, the famine happened before you were born. The war-torn country was not something that you experienced, but those reactions, those keys were pressed in another lifetime. And so that those emotions or those reactions are what are affecting us here, even though we're not playing those keys here.
Yeah. Okay, that's a great, I've not heard that before, but that's a great way to understand it. So those patterns, just like music, those are passed down. ACEs is a measurable score. So the ACEs scale has several questions on it, and we can tick them off. Did this happen? Did this happen? Did this happen? Intergenerational trauma is harder to quantify because we may not ever know what happened to our ancestors. So it's what we would say called diffuse. It's this difficult feeling or experience or challenge that I have in my life that I can't attribute to anything directly in my lifetime. ACEs is also individually focused, so it really focuses on me. What happened to me? Was I in a car wreck when I was a child? Was I in a home of alcoholics? Intergenerational trauma is relational and systemic, so it involves us in this larger view.
I can give you a really good example. I worked with somebody where her grandfather was an adult, and during the when the stock market crashed, and they had had all their money in the stock market. And so her father was brought up in, the depression, and in that we have nothing, you have to be, you can't, we use everything, we don't let anything go to waste. And then her father went on to create a lot of wealth in the family. But she had been that fear of lack had been so passed down from her grandfather through her father to her, that even though she has a philanthropic amount of money that is available, she can't. That fear of loss, of lack, is so strong in her that it affects her every day of her life still. So it's one of those things that she never experienced it, but the fact that her grandfather and her father had, and that those patterns of behavior, and that all of that was all of those emotions were passed down to her. And as an older woman today, she still suffers from that.
So, Bernadette, I think that's a good point, is that if you can't pinpoint it that something happened to you in your lifetime, it's probably intergenerational trauma. That's at least a direction to look if you haven't used that as a form of healing. So ACEs asks, what happened to you directly? And intergenerational trauma asks, what happened before you and how is it living in you now? So are you manifesting those patterns in your life today? Anything that you would add to that? Or
yes, just this is where you start to think about the things that you do maybe on a regular basis that don't. So, for example, as we talk about Irish families, which is what I came from, that idea, especially of food, of things like that, of lack, which we just talked about, where it gets passed down, but not only it gets passed down in a way. I had a great aunt that I talk about. She kept putting butter on the sandwiches. It's passed down in a way that you can recognize there's a pattern there, but not completely understand why you're repeating that pattern if it's not something that has affected you in this lifetime.
Right, absolutely. So we have this overlap here, Bernadette, with ACEs and parenting. So so I'm going to give like this short answer, and then maybe you can elaborate on that. So unresolved trauma impacts parenting, and that creates instability in the home. So thoughts about that?
That is a wonderful way of explaining it. It impacts in ways that I think we don't understand why our parents act the way they did towards us. It may have been where they haven't shown us a lot of love, or they haven't shown us. They were very mechanical about the way they treated us, things like that, and that comes from where their lack came from, how they were treated from their parents. So it's a highly emotional uh, response that we feel deeply. And when we don't understand where it came from, if we can look back a little bit and understand maybe the what our parents had experienced as the intergenerational trauma that was passed down to them, it begins to give us this story about why they may be their parenting skills are the way they are. So it is if we gently take a look, and it's hard when we have been hurt, when we feel that the trauma that we've experienced through this intergenerational trauma feels very real to us. But when we begin to understand and look back a little bit and start to understand the generation before and then the generation before that, we can begin to understand how we feel the way we are and how our parents had parented us because of the way they have been treated or they had been parented.
Yeah, so I think you're talking about attachment, Bernadette, and attachment is a big deal when it comes to intergenerational trauma. And I was actually thinking about, so as you know, I recently had a baby. He's 16 months old, and he's our only baby. And we worked very hard to get him. We had IVF and spent a lot of time and money, and just it was a big deal. And a lot of our ancestors, this was not a problem that they had, generally speaking. I mean, some people could not have children, and that was its own challenge. But I was thinking about my ancestors and the fact that they had multiple children and limited resources. And I was thinking about how they would attach to their babies. And I know, well, actually, when we had our baby, the doctor who helped us, he was a traveling physician. So we live in a rural area, and he was just here for a limited time. He had just been in Haiti, and he was talking to us about how he saved a baby that it was a simple procedure, but it could have been life-threatening. But he was really shocked by the response of the parents, that the father said, it's okay to let this one go, we'll just have another one. And I think that's today that environment still exists for parents to have to be okay with early mortality. But for our ancestors, that was a very common thing.
Oh, very common.
Right? We had to be okay with, we've talked on here about special names that babies might have had when they were stillborn, or, all of these rituals around babies, but attachment, right? So attachment is the way that we feel safe and secure and loved and happy with our parents. And it's often not actually Gabor Mate. I was listening to Gabor Mate talk about this recently, and he was saying that it doesn't matter the parent's intention. Like, I can love you very much as a mother, but if I'm not doing the right things for you, if I'm not available most of the time, or if I'm too rushed to interact with you, all that matters is what the baby is receiving in terms of attention and love and care. So, thoughts about intentional parenting.
Well, I think and that's so important, because attachment is something that you are kind of taught how to do by receiving it. So when you receive it, that love and that bond, you naturally will go bring that to your child, because it's something that you understand. And I can look back into records, ancestral records, particularly the 1900 and the 1910 census. census where they asked women, how many children have you had, and then how many are still alive. And sometimes there were great differences, that 9 children were born, 5 were still alive. So as Ruschelle is talking about, that when you feel like there may be that we may lose them, you just don't attach. It's too hard for you to attach the way that we think of attachment now, and how loving and how parents are with their children. But back then there was this, as Ruschelle said, that we had to deal with that we just another one can be born if we need another one. And so it when the parent comes down with that feeling, and as being raised in a family of 8 children, and there were 10 of us, the attachment was there, but I recognized, even myself, that the bond was there, but it wasn't as strong as I might see in somebody else's family, because there were so many of us. So it is, as Ruschelle says, it's such an important thing that affects so many of us, this feeling of that connection, and how it can show up in a very broken way depending on what previous generations had gone through.
So Bernadette, I just want to lay out what you said again. So ACEs versus intergenerational trauma. ACEs is this visible layer of, oh, I wish I had more attention from my mom. I wish dad would see me. So ACEs is the visible layer. Intergenerational trauma is the underlying system.
Right. And actually, as you're saying that, and so the reason I understand my ACEs, where the attachment may have been not as strong here, is why I understand it is because of the ancestral work that I did in looking back and understanding what my ancestors had gone through. So it's not something that I understood, always understood, but something that I have, when you do take an ACEs survey, it begins to help you understand why you have these, why you have the trauma that you have.
So, I think looking at your ACEs in context of your family, if you look at those questions and you look a little bit broader about how did we get here, ACEs are actually a lot of times the symptom of inherited trauma. So if I grew up in an alcoholic home, that was a symptom of my father's trauma and possibly his father's trauma and his father's trauma. So we can almost look at the questions on the ACEs as this is what we're currently dealing with. But if we look at ACEs in context of our historical context and cultural context, sometimes it's easier to understand why our families act the way they do.
And I think it is why people are so, and I'm going to use the word confused about trauma, because there is these layers of it. And it's easy to look back in your own life and see experiences that you have had that you can say that was a trauma experience in my life, and understand the feelings that are connected to that. But when it's layered, or when it's something that you haven't experienced, that's where it's really hard to understand and make sense of, and why people are often truly confused about, does this have anything to do with my ancestors? Because they don't have that story, and they only have the things that happened to them that they can remember from their lifetime or in their lifetime.
Yes. So, and I think we've mentioned on here before, and I mean we've even said it today. If you can't pinpoint something that happened in your lifetime, then possibly it happened to an ancestor and you're having to relive it. Now, I feel like it's very easy for me to say these things because for some reason my body responds very, very strongly, or I have a very strong physical connection to what happened to my ancestors. And I'll I'm going to reshare kind of the dream that I had and the recent experience that I had, Bernadette, which I know you've heard many times before, but um, I was recovering from Lyme disease and I had a dream that coal was coming out of my skin. And when I woke up, I realized that that was my grandfather's trauma of having worked in the coal mine, and that I was somehow shedding, that by being sick this way, I was somehow shedding his traumatic life out of my body. So that was me waking up from the dream. And then just recently, so another symptom that I had with Lyme disease was not shocking nerve pain. I felt like I was being electrocuted. And then I remembered that for all my lifetime, I had heard this story about my grandmother's brother, my great uncle, who died of electrocution when he was 11 years old. And I knew, I just recently, I said, I know that is my body processing that experience and asking it to be released in some way. So those are two not everybody has those types of experiences, but those are very clear experiences that definitely need ancestral healing. The only way I was going to get better is through honoring my great uncle.
And this is where the ancestral healing becomes important. When you know this just because of the ancestral work that you have done to heal this, it is when we can get the stories and can understand the experiences that we've had, it gives us knowledge that our bodies almost crave. We talk about people who, when they go to their homeland, let's say like when I went to Ireland, I felt like I was from the ground, from the earth there. I am all Irish, and that's and people have these very strong emotions around land or things that they are connected to through their culture. And trauma is also one of those things that is, so as Ruschelle talked about, so not only is she reacting to the trauma that her ancestors felt, but you are also from that area of where the coal miners are. So you understand that full coal mining story, as well as what the experience that was passed down. So we find it that intergenerational trauma and ancestral trauma and trauma that we are just experiencing, it all ends up kind of blending together sometimes, and which leads us to the confusion that, should I be doing this ancestral work, or should I just be working on the trauma that I've had in my lifetime? And that's why these conversations are so important.
Yeah, and I think that the answer to that question is it's all related, and you can certainly just work on yourself and never look at your ancestral stories, and still many people have successful experiences in individual therapy, and that's great, and they never have to look at this stuff. But I think this adds a whole other dimension to the experience if you are in therapy for something, just putting yourself in context. So and I want to touch on that actually, because over the years I've seen criticism to the ACEs. Especially recently, there's been a lot of criticism, and the primary criticism is that clinics are very busy. They will give people the ACEs test and then nothing else is ever done with it. There's no intervention. There's just nothing. It's just a score that sits somewhere and has maybe been given to the client. So, a few problems with that are that we've got information and we're not doing anything with it. And I think that is an overlap between genealogy. We've got information. Are we doing anything with it besides cataloging it or storing it? So any thoughts about that, Bernadette?
What immediately popped up is when we look back, it's the stories that we're missing. And you were just saying, when you said the word cataloging, it just kind of, genealogy as a is kind of, I tend to say it's like the Dewey Decimal System, where it's very orderly in terms of looking back at your ancestors. And this is what a lot of people think when they think about doing this type of work, that you're just putting names on a tree. But what we do when we are looking at a trauma-informed look at genealogy is bringing out those stories, is understanding that through those records and through those documents that there is an incredible story that just explains things more. We are connected to our ancestors. We're connected to them through DNA. So biologically, we are connected to them. And then and we are connected to as science is telling us, as I said before, epigenetics tells us that that traumas are passed down by the way our genes have been changed. And if we take a gentler look, if we start to look back and look at the stories, some of this begins to make sense. And it's not it's not a perfect way of helping us understand our trauma completely. As Ruschelle said, so many people have success just going to a therapist and working through the trauma. But when we add this layer of it to these stories, it really awakens an understanding in us, an understanding in our bodies of the trauma that has been passed down to us, and it's an important part of healing. There are many ways to heal, and this is an important part for many people.
So, Bernadette, that touches on this other criticism. So I'm going to go through criticisms of the ACEs. Although I love ACEs, I think it is so clear and it's a good map for making sure that we are healthy and well if we've had experiences in our childhood. But it doesn't measure protective relationships. It doesn't look at resilience. And it doesn't look at coping strategies, and it doesn't look at meaning making. So I think one of the biggest things that I've gotten out of doing ancestral healing is, yes, I have looked at the hard stories in my family. I've done a little bit of genealogy. I've looked at all the sadness and the pain, but you also really get a deep appreciation of how resilient your family is, and how, I think I've used the words badass on here. I feel like my female ancestors, especially, but of course, my male ancestors as well, just how badass these people were for what they lived through. So thoughts about resilience and doing this work.
Yeah, there is, and that is that's the part that's like the secret sauce in doing ancestral work and even in the ancestral healing, is that you do find these incredible stories of resilience, and you understand, wow, that's why I'm, as you said, badass. That's why I have this strength in me. I've talked again about this one great aunt who they were all orphaned, and she's the one that kept them together. And I was like, how did you do that? How did you get this family of girls? There were 5 of them, all living. And I never knew these stories until after everybody had passed away and I did the genealogy and saw. So there is that whole other side of it that you discover, and it makes so much sense. The resilience is a very powerful way of counteracting the trauma that also happened. And in your life today, with everything that you've gone through, that you keep going, that you keep moving forward. If you're here, it's because you're like, okay, is there some other way that I need to heal? And so I need to learn about this, because there's this resilience in you that says, I need to understand this more. I need to know why I've gone through, or why I'm feeling the things that I am.
Yeah. Yeah. It really adds a layer of, I mean, I think most people, if they've been through therapy, hopefully the end result is that you appreciate yourself a lot more and you can see how strong you are. And then to extend that to the people that you love, or maybe even the people that you've been annoyed by over time is a really nice feeling. So I think what we're hoping to do here is to move from just screening or just looking through data, and really looking into transformation and integration. And that is really the purpose of, I love how you called it, Bernadette, trauma informed genealogy. That's not something that's super popular, or I think many people know anything about. But I would say, I think a lot of anybody who's signed up for Ancestry and started to look deeply at their family's experiences, there is some sort of transformation there, even just starting to look at the stories without any sort of deep dive. So yeah, go ahead.
Well, it just makes me think of, often when we look at our, if you are in a family where, you look at your mom or your dad, and some of their stories, because sometimes we'll know the stories of our immediate family, that they came through, and you're like, wow, they came through that. But when you begin to peel back the layers, and it's peeling those layers back, that there's so much there. And the transformation, as you just mentioned, it happens every time. I don't think there's anybody that's ever looked back at their ancestry and not had transformational moments, whether they are like, I'm related to that person, which is often the catalyst that gets people going to see. But it is when they look back and say, they came through that. That's incredible. I'm here because they came through that. And so that transformational part is amazing, and is something that is very, very much part of the experience of looking back.
So, Bernadette, possibly, so as you're talking, I'm thinking about this last little bit of research I did here, just pulling out some simple documents, some naturalization papers and some Ellis Island manifests, and those sorts of things. The census. It's reminding me of how much you can glean from one document if you know how to look at the document, or you are working with a genealogist. You can really see the historical context and the psychology of the people in the moment. I know Michael, who saw my grandmother's naturalization paper, he was like, oh, isn't that a work of art? Just even the fact that they put so much detail into the beauty of these documents says something about the time that they were living in. So with all that said, I wonder if next week we can really focus on genealogy.
Mm-hmm. And really talk about how these documents show what you can find, and the experiences, even discovering that your ancestors came through Ellis Island. It gives you a whole story of what their experience was like without even just knowing that that's the port, that's where they came through. The stories of what they went through, and yeah, don't get me started. I was about to. I have a laundry list of stories I could share. So
yeah, and I get it, Bernadette, because we went. They've redone the hospital there at Ellis Island, so you can see how they were filtered through the hospital, and that it was a research hospital. So there was also research being done on the people coming through Ellis Island. I mean, it's just endlessly fascinating. So maybe next week we'll focus on diving, like how to use your genealogy documents in a trauma informed way. How does that sound? Yeah. Okay.
Sounds great.
Okay, great. So Bernadette, anything else as we have a few minutes left. Was there anything else that you wanted to do or go over today?
I think we have covered a lot, and I think that trauma is one of those things that many people have had so many questions about, and we're going to continue to talk about this over and over, because that's why we've created the Ancestral Healing Center, is so that people can understand what the things that they have gone through.
Yeah, absolutely. So, well, thank you, Bernadette, for spending the day with me again, and thank all of our viewers for watching, and we'll see you next week.